The coalition is trying to get into nursing homes and other PACE eligible facilities to see if they can teach the workers there, the healthcare workers there, how to have conversations like that. And especially now with COVID-19, I think in the primary care offices, a lot of things have been deemed like not urgent or not important. A lot of people actually don't know the options that they have, or they have misunderstandings about the options. You know, a lot of people hear a DNR and they feel like they're not going to treat me, they're just going to let me die. And they hear a full code, they're going to treat me, they're good. But that's not what it is. Even if a person is a DNR under that category, there are other options. Well, do you want full treatment? Do you want partial treatment? Do you want a test period? So I think educating people about that aspect of choosing a do not resuscitate, I think that education opens it a lot better, because the first thing you hear, well, I don't just want you to let me die. And so we explain, and then again, people don't understand what, you know, full code, full CPR, full treatment looks like either. So a patient who is 98 years old and chooses full treatment, a frail patient, they need to understand your ribs are probably going to be broken. You're not going to, we might resuscitate you, but you won't be the way that you are now. You're going to be hooked up to a ventilator. You're going to be hooked up to tubes for feeding. And we don't say that to scare you, but that's the reality of what a full code, full treatment looks like. You're going to spend the rest of your life in the hospital until you die. And if that's something that you want to do, we support that and we will push for that. But some people opt to pass at home peacefully, or some people want to pass at home peacefully with their family, but they choose a full code, but they don't understand what that all entails. So we're finding that just providing education, and the goal is not to push a patient in one way or the other. It's not to give our opinion, even if the diagnosis is grim and, you know, there's really low chance of survival. It's not to say, hey, this is what I think you should do. It's to say, these are the options. This is what a full cold full treatment a year down the road, this is what it looks like for you. This is what a DNR partial treatment or a DNR no treatment comfort care, this is what it looks like for you a year down the road. And it's okay to take a day to think about it, take a week to think about it.